Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a unique and in-depth show for you tonight. We're talking about vascular health. Your body is made up of a network of tubes called vessels that move blood and other fluids. This is your vascular or circulatory system. Vascular disease is any condition that affects this system. We'll be joined by a panel of professionals in the field, hearing patient stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at vascular health with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have a wonderful panel of guests joining us. Meet Dr. Timothy Oskin, Section Chief of Vascular Surgery for St. Luke's University Health Network. He specializes in endovascular surgery and has a special interest in the minimally invasive treatment of vascular disease. Dr. Oskin is board certified in general and vascular surgery and has advanced training in the treatment of complex arterial disease, carotid artery stenting, and thoracic aortic disease. He's a graduate of Wake Forest University and Hahnemann University School of Medicine.
How does anybody get to be a doctor? That's always a great question. Went to college, liked the health sciences, got into medical school, liked the kind of hands-on approach of surgery. Vascular surgery continues to evolve. It becomes more and more technical. We're using all kinds of different techniques. We've actually built a hybrid operating room which kind of marries an open surgical theater with a catheter-based endovascular suite. And that's allowed us to do many advanced procedures and really kind of minimize some of the impacts on our patient, minimize recovery, and optimize our outcomes. It's actually very easy for me to recommend St. Luke's. We really put patients first, so it really is the driving force for me, at least working at St. Luke's.
Dr. Oskin, before we get started, what exactly is vascular disease?
Well, it's actually a pretty tough question to answer because when we talk about vascular disease, we really kind of divide up into multiple different segments. If you have vascular disease affecting the arteries in your neck, the carotid arteries, we are usually talking about stroke and the risk of having a stroke. If we're talking about vascular disease in the legs, we're talking about problems with walking. We can talk about disease affecting the main vessels in the abdomen, the aorta, with aneurysms and things like that. So it's a very broad question, but it's really usually brought about some sort of plaque buildup within the vessels, which unfortunately is very inherent to people in the United States.
Great information, Dr. Oskin. Joining our panel next is Dr. Jay Fisher, a vascular surgeon at St. Luke's. Dr. Fisher has been practicing vascular surgery since 1989 and feels extremely fortunate to be part of the St. Luke's team because they have been provided some of the greatest technology that's available in the country. Dr. Fisher became interested in vascular surgery during his medical training at the University Autónoma in Guadalajara. He's board certified in vascular surgery. Dr. Fisher's approach to his patients is to treat them like family and guarantees their treatment plan will be tailored to their individual medical needs.
The vascular center is made up of basically three components. We have the interventional radiology, vascular surgery, and the vascular lab. I'm the medical director of the vascular center and a vascular surgeon. As a medical director, I oversee the vascular surgery aspects as well as the interventional radiology. I feel that we've built a really quality-driven program. Goes back approximately 30 years where we started the vascular group and our relationship with interventional radiology to have a practice that will only do what's right for you and your family member, and where there's no competition between groups in the hospital, really has turned out to be an ingenious system. I truly believe that patients who come to St. Luke's, whether it's in the vascular center or whether it's in our other network hospitals, will get the best treatment possible. And if no treatment's the best treatment, that's what they'll get.
Dr. Fisher, Dr. Oskin mentioned the complexity of treating vascular disease. Can you tell me a little bit about some of the types of procedures that a vascular surgeon might perform and why someone might be referred to you?
Sure. I think one of the most exciting procedures that we perform is to repair abdominal aortic aneurysms, which are basically bulges or dilations, enlargement of the aorta. And in the old days, we used to make an incision. Patient would be in the hospital for a week or two at times. Now we treat about 75 or 80% of these aneurysms through the groin, home the next day with 2 Band-Aids.
Isn't that an amazing advancement?
It boggles one's mind, really.
Really incredible to see that progression. Thanks, Dr. Fisher. Let's meet our final panelist, Dr. Michael Ringgold, an interventional radiologist at St. Luke's University Health Network. Dr. Ringgold completed his medical training at Temple University School of Medicine, followed by his residency in radiology at Temple University Hospital, where he served as chief resident. Dr. Ringgold is board certified in radiology and spent a fellowship year training in interventional radiology. He enjoys taking care of patients and working with the physician staff in an open atmosphere of communication. Dr. Ringgold believes the cutting-edge technology available at St. Luke's has allowed him to take better care of his patients.
I love the people I work with, I love taking care of the patients, and I love the variety of cases that we encounter every day. My primary job in the hospital is as an interventional radiologist. Interventional radiology is a minimally invasive specialty. We basically use various imaging machines to perform procedures inside patients' bodies, and we use these machines to guide our needles or catheters. The Vascular Center for Excellence will allow patients to stay in their community to get care that they need. I would recommend St. Luke's to not just anybody. I bring my family to St. Luke's. I think that the physicians are outstanding. I think the staff is fantastic, and I think that's reflected in the IBM Watson rating that we constantly receive the highest level for year after year.
Dr. Ringgold, our first 2 panelists are vascular surgeons. You're an interventional radiologist. Explain to us what the difference is and how you work together.
Interventional radiologists do procedures that span the entire practice of medicine. They're minimally invasive, so they're really non-surgical or very outpatient, minimally invasive procedures. A majority of what I do is in the vascular disease, so we overlap and complement each other with the procedures that we perform.
Excellent. Thank you all for giving us a better basic understanding of what vascular disease is, what some of the procedures are, and how interventional radiology works with the vascular surgeons. We're going to dig deeper into how St. Luke's treats patients with vascular disease. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Compassion, innovation, technology. Trust your heart to one of the nation's 50 top cardiovascular hospitals. My Health, My Hospital.
St. Luke's.
I had a clogged artery in my carotid prior to a valve placement in my heart. Dr. Oskin was definitely the best of the best for my carotid surgery. I really appreciate him. Thanks to Dr. Oskin, I have a healthier life schedule too. My wife and I do a lot of walking. We walk probably a mile a day, something like that. I eat more vegetables, and I'm going to live longer, and I'm going to have a lot of fun in life. I recommend St. Luke's to everybody. Having a health network right here in our community is unbelievably fantastic. I have a binder that's filled with, I think maybe 15 different doctors that I've seen over the years that I've been going there. They've all showed a dedication to making me and helping me live longer. I want to enjoy my grandchildren. I want to see them get married, etc. I'm very happy that they're close by and they're a part of my family, my medical family.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being here today and providing us with questions, which we'll get to later in the show. Joining me is an important panel of medical professionals, Dr. Oskin, Dr. Fisher, and Dr. Ringgold. We've started to discuss the basics of vascular health. Now we want to get a better understanding of patient care and how St. Luke's provides that to their vascular patients. So Dr. Oskin, what are some signs and symptoms that a patient might be experiencing a vascular-related issue? How do they know they need to go to their doctor in the first place?
Another good question, but one of the things that is a little troublesome about vascular diseases often is asymptomatic, so it does not cause symptoms. So it does kind of point out that you really need to be seeing your medical doctor, getting your appropriate screening tests, etc. But in general, if you come to your medical doctor and you're having problems where, say, you can only walk a certain distance before your legs start to hurt and you kind of rest and it goes away and it comes back, that might be a sign that you have a blockage in one of the arteries in your legs, limiting the flow to your muscles as they're trying to walk. If you have a blockage in your carotid artery, as I mentioned a little bit earlier, a piece of that plaque could break off and actually cause a stroke. You see all the signs that advertise for what those symptoms are, the FAST. So, drooping of the face, asymmetry in the face, weakness in an arm, things like that would be signs that you might have had a stroke, even if it only lasts for a few seconds or a minute. So those are some of the more profound symptoms that you might see if you have vascular disease.
So being really in tune with what's going on with your body and, of course, communicating that to your primary care sounds pretty important.
Absolutely.
Dr. Fisher, once a patient is referred to you, what happens next? How are they assessed in your office?
So we will greet the patient and take a brief history to figure out what part of the vascular system is there a complaint about, or that usually a primary care physician picks up a patient who has a symptom or is on a physical exam. For instance, if the primary care physician heard a sound in the neck that we call a bruit, that may show that there's a blockage in the carotid artery. So that patient would come and see us. We would do a complete history and ask about the symptoms of a possible mini stroke or stroke, and then do the appropriate imaging, which is usually ultrasound first, and then most of the time a CAT scan angio, which then provides the most information about a blockage. And usually these blockages they can go from 20% to almost complete blockage. Most of the time we're not treating them unless the patient's having a symptom or the blockage is over 80% would be an indication for a treatment plan for them.
But knowing that they can change, important to get that comprehensive screening to know where you're at.
Correct.
Dr. Ringgold, what kinds of patients or people are looking for a vascular disease? Is this something we see in a certain type of person in the population? Is it aging adults? Are there signs and symptoms that certain people should look for?
There are definitely risk factors which will make you more likely to have vascular disease. People who are smokers, diabetics, aging in general. But as Dr. Oskin said, most of the time you don't know you have it until something happens. And it is important to know that you have it because there are associated, to prevent things from happening, but also if you have a difficulty walking because of vascular disease, you may have vascular disease in your heart or in your carotid arteries as well.
So finding out what's going on and where it's happening is so important. Dr. Oskin, when a patient is diagnosed with some sort of vascular-related issue, how do you come up with their care plan? What happens next?
Again, it depends a little bit upon what the problem is, but we'll obviously start to kind of look into what those risk factors are that Dr. Ringgold mentioned and try to treat them. So if somebody has high cholesterol, we're going to make sure they're on a cholesterol medication, on appropriate diet. We'll make sure they're on their appropriate blood pressure medicines, make sure they don't need a blood thinner or something like that. But then if we start to really kind of define a major problem, we will, as Dr. Fisher also mentioned, start to get some imaging studies so as we get a little bit of a better idea or better handle on exactly how severe any disease is. And if it is severe, the next step is really to get kind of a roadmap of where those blockages might be, what the distribution of that disease is, before we really kind of put together a treatment plan with that patient. So as you kind of see, we start to kind of build through the process. The more severe the disease gets, the more information that we need to really kind of come up with a plan tailored for that patient.
Of course, now all of this is a lot easier, Dr. Fisher, because St. Luke's has the Heart and Vascular Center. Can you explain to us why this is a unique setup for a hospital to have invested in?
It is. It's a very special center. It's a multidisciplinary process where the vascular surgeons who work side by side with the interventional radiologists, the cardiologists, as well as the open heart or cardiothoracic surgeons. So we work as a team, and we actually utilize each other's skills in many different types of cases to optimally treat the patient. For instance, on a thoracic aneurysm, we'll have actually an interventional radiologist, a vascular surgeon, and a cardiac surgeon available, so that if there is the potential for complications, which most of the time don't happen, but that we're there ready to handle those complications. And we have a hybrid operating room, which is really second to none in the country. And we are able to work there both in an open setting as well as endovascular or inside the artery setting.
It's really incredible for patient care to have all of the right team members in place in this center. Dr. Ringgold, we'll pick it up with you after the break, and we'll learn more about the St. Luke's Heart and Vascular Centers. You're watching St. Luke's Health Now.
Active bodies. Healthy food.
Children are our future. A bright future depends on good health.
Strong minds.
St. Luke's is committed to promoting healthy lifestyles for children.
Healthy kids, bright futures.
Help provide a bright future for our kids. Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a great show tonight. We're talking about vascular health. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Timothy Oskin, Dr. Jay Fisher, and Dr. Michael Ringgold. Thank you guys for being here. This has been a really interesting discussion, and in the first part of the program, we established a little bit of an understanding of what vascular health is, how patients are assessed, what some of the warning signs are, and the help that's available. Now we want to dig a little bit deeper into treatment and technology options. So, Dr. Ringgold, I'm going to start with you. Can you expand upon some of the types of procedures that would be available at St. Luke's at the Heart and Vascular Center?
We will be able to do pretty much any procedure that can be done by a vascular surgeon or interventional radiologist. We'll be able to treat peripheral vascular disease, aneurysm disease, carotid artery disease. We'll be able to treat venous disease, as Dr. Oskin mentioned earlier.
It's really interesting that you can treat so many things, but these are also generally very scary words, Dr. Fisher. People are hearing things like aortic aneurysm, carotid artery. We know inherently these are important pieces to have in our body intact. So how do you approach this with your patients, and how treatable are a lot of these issues?
I would say most of the patients that we see, the majority are treatable. Certainly, we always start off with conservative or medical management, reducing risk factors, especially smoking cessation, which is hugely important, and that really is the answer to a lot of these problems. However, patients do present later in the disease process, and we have to then tailor a treatment program based on the disease process. Many times, the risks outweigh the benefits of a treatment plan, and therefore we would hold off on any invasive study. However, most of the time we are able to usually start off with minimally invasive and then work to open surgery if we need to, if the minimally invasive is not working for that patient.
And that's a good conservative treatment plan, I would imagine, puts most patients' minds at ease. Dr. Oskin, what types of technology are available? I have got to think that this field has changed so dramatically over the years. What kind of technology is available to make some of these procedures more accessible and aid in the treatment of vascular disease?
It's a great question, and the honest truth is 20 years ago, we were really doing mostly open surgery. And everything we did had, some pretty significant risks to it because they were major operations. And as we've kind of evolved over the ensuing 20 years, we've come up with more minimally invasive techniques to treat vascular disease. The good example that we have is really carotid disease. 20 years ago, every carotid blockage that had to be treated was treated with an open surgery. Within the past 10 or 15 years, we started using stents to treat carotid arteries with some very good success, but we did find that there were some problems in that patients unfortunately had a higher rate of having a stroke or a neurologic event during that procedure. And now over the past 3 or 4 years, we've actually kind of put those two procedures together, and now we have kind of a hybrid approach in which we treat carotid disease. It's a kind of a fancy procedure in which we actually put a catheter in the artery directly in the neck, put a catheter in the vein in the leg, and actually connect the two. So while we're actually delivering the stent, if a piece of debris breaks off, it actually floats backwards in that system and gets filtered out, and the blood gets given back through the venous system. So we continue to evolve in vascular surgery to really kind of find the ideal procedure for each of these kind of disease problems.
It really is incredible what you can do. And you mentioned that hybrid OR. Dr. Ringgold, how revolutionary has the hybrid OR been to see interventional radiology, vascular surgeons, and cardiologists being able to work together for patient care?
It's been fantastic, actually, I think, especially for the patients, because they're able to get a procedure that they need in a single setting. They're able to, whereas in the past they may have had to come in one day for a procedure and then come in a week or two later for another procedure, they can get it done at the same time. But it's also allowed additional procedures and new techniques to evolve that we couldn't have done in the past, such as the carotid stents.
That's pretty amazing. Dr. Fisher, you talked a little bit earlier about the Heart and Vascular Center. Tell me about the plans for the expansion for the network and how this will help patients in the future.
Yeah, we're very excited about expanding our heart and vascular practice to the Allentown campus. And actually we're in the process of putting a second hybrid operating room, which is really unbelievable. We'll have a second hybrid operating room. And we're creating a vascular center of excellence, meaning that we will be treating patients and actually in many ways concentrating on limb salvage. Patients who present with tissue loss in the foot, who need revascularization or more blood flow to that foot, and working with the interventional radiologists and the podiatrists at St. Luke's Allentown, which is where the residency is. We will be basically providing a top-end limb salvage program for that as well as other things that we do.
It's incredible to see the expansion and really the investment by St. Luke's for the patients in this area. So thank you all for that information. Up next, questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now. Not feeling well? Need to see a doctor now? St. Luke's video visits 24/7. Connect with a doctor online now for all your urgent care needs. From your smartphone, tablet, or computer, it's never been easier for patients to access care. A doctor will be able to assess your healthcare needs and even send a prescription if necessary, all in one quick session. Download the St. Luke's mobile app from the App Store or Google Play Store. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our amazing panelists. We've had a great conversation about vascular health at St. Luke's. Now we're going to take some questions from our viewers. All right, so Dr. Oskin, I'll start with you. What are some consequences or complications of ignoring vascular disease?
Well, it's really all the same symptoms we've been talking about, unfortunately, plus. Stroke is a big one. Unfortunately, if your vascular disease progresses to a point in which you have severe blockages in your carotid arteries, unfortunately the risk of stroke goes up. If you have an aneurysm and either you don't know it or you're ignoring it, it's unfortunately the risk of an aneurysm is actually rupture. And that's not something any of us want to have because that unfortunately has a very high mortality to it. And when we're talking about the legs, the more severe the blockages get, it limits the flow incrementally to your feet to the point where you might get pain at rest. And then worse beyond that, you might get wounds on your feet that don't heal, and the dreaded word gangrene could set in. So they're very, very significant problems if they're ignored.
Yeah, not an illness that you want to ignore because the consequences could be serious. Dr. Fisher, this audience member asks, what are the age-related changes to vascular disease?
So that's a good question. And actually, aging is a risk factor of vascular disease. Unfortunately, as we all get older, the sequelae of just getting older you can build up plaque in your arteries, and especially in patients or individuals who have not been living a healthy lifestyle, who are smoking, who are not exercising, who have diet indiscretion, a lot of red meat, unfortunately, and I think that other factors like diabetes and hypertension. So as patients get older, we do see more and more vascular disease. Fortunately, for those who have lived healthier lifestyles, it'll be a lot less.
Okay, so best to take care of yourself early.
Absolutely.
Excellent. Dr. Ringgold, this question is for you. If a family member is being stubborn about their health, how can they slowly be introduced into the best plan of care?
Once they arrive at the vascular center, the goal is to make this as easy as possible on the patients. We have a nurse navigator who will help them through the steps of seeing the physician. We have physician extenders and advanced practitioners who will help educate the patients and help them understand what sort of problems they're facing and what their vascular disease means.
Okay, excellent. Dr. Oskin, at what age should I begin to ask my doctor about my heart and vascular health? Is there a magic number like we have for a mammogram or something else?
Well, that has a lot of factors that kind of feed into the answer. It depends a little bit upon your family. There are definitely some age-related risk factors if you have early onset vascular disease in family members. Say you have a father that had an MI when he was 40. Well, you ought to be evaluated when you're 40 or such. But if in a kind of a global sense, the atherosclerotic age group, which is the patients with vascular disease, is usually those patients in the 50s, 60s, and 70s. So it's kind of the later years. But there's no absolute number.
But something to be aware of certainly is family history, lifestyle choices, and how that could affect early onset of vascular disease.
Absolutely, well said.
All right, Dr. Fisher, if you need surgery, how does St. Luke's care for me pre and post surgery?
So preoperatively, we want to maximize the medical condition of the patient so that during the operation, whether it be endovascular or open, that they have the best chances of getting through the operation without a complication. For instance, most patients who undergo peripheral vascular surgery will have a what we call cardiac clearance or risk factor of problems with heart disease, because there's a correlation between vascular disease and heart disease. So if they clear that and they have their surgery, it'll be a lot safer for them. So we work very closely with the cardiology team at St. Luke's.
It's really sort of a good thing to know that you're getting that extra checkout before you're going in.
And then post-operatively, depending on the operation, we'll be looking for different potential complications. We have our intensive care units and critical care, and hopefully that patient will walk through that and eventually leave the hospital for post-op care. Yeah.
Dr. Ringgold, I'll end with you and ask, why is St. Luke's the best choice for vascular care for me?
St. Luke's, aside from having cutting-edge technology, it's the culture, I think, at St. Luke's that makes St. Luke's so outstanding. It's all about quality of care and taking care of the patients and delivering the best care in the most efficient way that we can.
Wonderful. Thank you all so much for being here. Thank you for informing us about our options and about our health here this evening. We appreciate it. Thank you so much to our audience and to our crew. For more information on vascular health at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember it's important to focus on your health now.